You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a serious topic, chronic snoring and sleep apnea. There's now a way to correct it, to reverse it, to stop it. And according to my first guest, people that are chronic snorers or have sleep apnea, they can't sleep in the same rooms. And now with this FDA-approved device, they can eliminate the snoring in certain cases and eliminate their CPAP and get a good night's sleep. With us, we have Dr. Chris Henninger. Dr. Henninger, welcome to the program.
Thank you, Randy.
All right. Now, you say that this works, by the way. This is an effective, it's FDA approved for what?
Right. It's FDA approved for the treatment of obstructive sleep apnea. So there's 3 different categories: mild, moderate, and severe. And even the Academy of Sleep Medicine recommends oral appliance therapy, which is a dental device. It's not made by a physician, it's made by a dentist, for the treatment of the first line treatment for mild to moderate sleep apnea.
So explain to me how it works. Okay, so their airway is being blocked and you're opening it up?
Randy, the typical treatment for obstructive sleep apnea has been the CPAP machine. It's this large machine that sits on the side of your nightstand, and it's a big mask that you wear over your face, and it blows air down your throat all night long and keeps the airway open so you can have that restful sleep. This solution is a much simpler solution. All it does is it advances your lower jaw to keep the muscles from collapsing the back of your throat, allowing it to be easier for you to breathe at night.
So when you open up the airway, and are some people, their snoring goes away?
Exactly, Randy. The snoring is the vibration of your soft palate in the back of your throat when you're trying to breathe. And so it's obstructing your ability to breathe. And when you bring your lower jaw forward, it brings all that tissue out of the back of your throat and eliminates snoring, which is a huge advantage for somebody who's trying to, whose wife has kicked them out of the bedroom because of their loud snoring.
You say that happens a lot.
It does. I had a patient, Jason, just the other day, and he's actually my age, but he has moderate sleep apnea. And his doctor said, you need to be on CPAP if you want to get rid of your snoring. And he said, I'm not doing that. Because his dad has had it too and was on CPAP. And he says, I am not doing that. And he's my regular dental patient. And we got to talking about it during his regular dental visit. He says, yeah, my doctor wants me to be on CPAP. And I told him no. And I said, well, why don't you try a dental device? Or, this oral appliance. And he's like, he never gave me that option. And I said, yeah, it's simple. It's like a retainer. You wear it at night, it advances your lower jaw, and it reduces or eliminates, in some patients, the snoring. And we just recently got him into wearing it. He's been in it about 2 months now. He's like, Dr. Henninger, it's the darndest thing. My wife lets me sleep in the room again. It's really funny because, his wife is a patient in my practice and his teenage daughters. And we just did the wisdom teeth on the daughters. And it's a very attractive family. And you're like, this guy has a major problem if he can't sleep in the same bedroom.
But that's common. I think we've all heard stories of a guy that snores so bad that they can't sleep in the same room because everybody wakes up exhausted.
And we all have that uncle who falls asleep watching TV and starts snoring, and everybody in the room laughs at him. And, there's probably a couple reasons why that's happening, and one of them is probably because he's not getting the restful sleep that he needs at night. And it may be that he knows he has sleep apnea and he just doesn't like the solution, which is 50% of the people who wear CPAP end up discontinuing the use.
Now the CPAP, for people that don't know the CPAP, I guess it's a hose and it forces air down your throat.
Right. It creates
is that true?
It creates positive pressure. It's a little machine. It hums. It has to be plugged in. And it forces air, it creates positive pressure.
But it works.
It works 100% of the time if you can tolerate it. And there's been scientific studies that say at least 50% of people don't tolerate CPAP. At least 50%. Those are the ones that will admit it.
Yeah.
And so, this is it's not necessarily a new option, but it's an unknown option for the treatment of sleep apnea. It's so unknown that a lot of physicians don't even know about it.
I know somebody you helped. He's a rower and a water skier here in San Diego.
My partner, Craig
He's
Henninger.
been on my show, Dr. Craig Henninger. Yeah. Tell me about that. So it helped him.
Yes, and he was another one of those people that he's like, yeah, my wife is always mad at me, and I don't know why. And it's just kind of this thing in our marriage. She's just always mad at me. And he's like, I knew I had probably mild to moderate sleep apnea, and we got him tested, and he had moderate sleep apnea. And we got him into an oral appliance, just like this one right here. And
was he skeptical? At the beginning?
He was, and I knew what it could do for people, but he was a little bit skeptical in the beginning, and but we convinced him to wear this oral appliance. It's just like a retainer, and it's very easy to wear. Or some people wear night guards.
He's a dentist. We should mention he works
Yes.
with you there, Dr. Henninger.
Right.
And okay, so go ahead. I'm sorry.
And he's like, it's the strangest thing. My wife's not mad at me anymore, and I don't even think she knew why she was mad at me, but it's because she was not getting sleep either because of his snoring. And so again, we made a positive impact in
He
his
looks,
life.
I saw him the other day when I was visiting. He looks fitter. So I guess when you sleep, you have more energy to exercise, you have more energy to do a lot of things.
Right, and it improves your metabolism. If you're not sleeping right at night, it's virtually impossible to lose weight. And that's another added benefit of treating your sleep apnea, whether it be by CPAP or
So
oral
they
appliance.
think they're sleeping, but they're not.
Correct. So,
Is that right?
So, as far as you're aware of, you think that you're sleeping. Other than you may be a little bit tired in the morning, have to have an extra cup of coffee. Some people have morning headaches, but all that goes away when you treat the sleep apnea. People have just, for years, been afraid of the solution. Everybody knows what the solution is, the CPAP, but people have been, just extremely afraid of that.
So Dr. Henninger got it done.
Right.
Did you change his life?
Yeah. He doesn't take those afternoon naps like
You
did
say
before.
patients give you a hug. Did he give you a hug and say he didn't?
Dr. Henninger's not the hugging type, but
All
no,
right.
he was extremely happy that it was such an easy solution. So on a serious note, his ENT doctor had been trying to convince him to have the palatal surgery for quite some time, and he had just been avoiding it because he didn't want to have the surgery. And he's like a lot of people here in San Diego. They may know that they have a problem with their sleeping, but they're afraid of the solution, whether it be, surgery is another common solution.
So he was going to get surgery, maybe?
Well, his doctor was trying to get him to pursue that route, and he had been delaying doing that for quite some time.
So he swears by this now.
Absolutely, because in his case, he avoided having to have surgery by just wearing this simple dental device.
Now, this is a serious topic. It's a medical device. We should mention that if you have PPO insurance, insurance covers the cost of this.
Right, it's covered.
Is that right?
It's covered by major medical insurances, covered by Medicare.
So Medicare
Medicare
covers
covers
this.
this device, yes.
So would you say that there's like thousands or tens of thousands of people in San Diego that have this, that they don't even realize that medical insurance covers this at a dental office?
That's correct.
Really?
I really feel that way. We've been doing some lectures about sleep apnea lately, and a lot of people are surprised to find that Medicare would cover this device for them, and most major medical insurance also covers the device.
Is it more men than women that have sleep apnea or chronic snoring?
Yes, men are 2 to 3 times more likely to have sleep apnea than women, and it also increases with age. So as the women don't typically have it when they're younger, but when they get older and go through menopause, that's when sleep apnea shows up in women. And a good story, my patient Candy, she, very tiny, petite woman in her 60s, and I did a smile makeover for her, so, it was a very personal relationship with her. She had been gone from my practice for, several months. And she finally came back, and I said, Candy, where have you been? I want to check on my smile, make sure you're taking care of it. I was just kind of joking with her. And she said, I had a heart attack. And I said, oh, I'm sorry to hear that. And she's like, yeah, it's the weirdest thing. I don't take any medicine. I'm not overweight. I'm healthy. And I just, out of the blue, had a heart attack. And she's like, I'm very upset about it. And I asked my doctor, I said, why did I have this? I don't have any medical problems. And the doctor said, I don't know. I don't have an explanation for you. And I just started talking to her a little bit, and I was like, Candy, do you snore? She says, yes, I have a terrible snoring problem. It's kind of embarrassing. And I said, have you ever been tested for sleep apnea? And she's like, no. I said, people who have sleep apnea, snoring is the #1 sign. And, if you have sleep apnea, you could be, over all these years, increasing your risk for a heart attack, and this might be the reason.
Because of what? The stress hormones?
Yeah, it increases at night when your body, just think about if you started to hold your breath right now, your pulse rate would go up, your blood pressure would go up, because your body is trying to pump blood to those vital organs like your heart and your brain. When you stop breathing at night, the same thing happens. Your body starts going into overdrive, and the adrenaline builds up and the cortisol builds up in your body, and your body's trying to tell itself to function, but you're starving it of air. and or oxygen.
So did you send her to a sleep lab?
No, we actually tested her in my office. I'm so passionate about this.
Really?
I actually have a home sleep test that you can use for 2 nights, and I don't charge patients for it because I'm so passionate about helping people figure this out that they go home with this little headband type thing and they wear it, and it measures 7 things about how you sleep. Your position, how much oxygen is coming in and out, if you stop breathing, the noise that you make. And so she took it home, and sure enough, she had borderline moderate to severe sleep apnea. And she looks at me, she's like, "This is why I had a heart attack. I know it." And she went back to her doctor and told the doctor why she had a heart attack. And he's like, "Yeah, you're probably right." And but he failed to identify that as the root cause. And I don't know if it was like the thing that pushed her over the edge, but it was the long-term snoring or chronic apnea that had put just a lot of stress on her heart and ultimately led it to fail.
If you're single and sleeping alone, you don't know you have it.
Correct.
So it's mostly couples that know the other one has it.
The most often way that we diagnose sleep apnea is the spouse will say, "Yeah, he stops breathing at night. It kind of scares me, and I have to like shake him to wake him up to make sure he starts breathing again." So witnessed apnea or the stopping of breathing is the #1 way that we diagnose this.
So PPO insurance, Medicare, the dentist, I want to make sure I have this right. You make this medical device,
Correct,
custom for them, opens up, because they breathe fine all day long.
Yeah.
And you open up their what? You call it their bite, open up their airway?
We do 2 things, and this is sort of technical, but we advance their mandible or their lower jaw to prevent the airway from collapsing at night, even when the tonicity of those muscles relaxes at night, because that's what happens when you sleep, everything in your body relaxes. And when those muscles relax in the back of your throat, they typically block off your airway. But if we advance your lower jaw, it pulls those muscles forward and they naturally rest in a more advanced position so that it takes less effort to breathe. So therefore you're less likely to stop breathing. And then we do open your bite just a little bit because, again, this is sort of a theory that we have. If you increase the vertical dimension or how much your bite is open, they will also allow you to breathe easier. So I got to talk to you about Candy a little bit more. We sent her home with the sleep test, and we had her tested, and it turned out she had sleep apnea. But she stopped breathing 30 times in the matter of an hour. So she wasn't able to get that restful sleep. You go into REM sleep. That's where your body really rejuvenates. And she was pulling herself out of that REM sleep 30 times per hour. That was her number, 30. And can you imagine waking up 30 times per hour? She woke up in the morning and she had the morning headaches. And she was tired,
right?
Yeah.
30 times?
Yeah, 30 times.
In an hour?
Right.
So that's reversed for these people. You make the appliance. Do you do a comparative study?
Correct. When we fit them with the device, they wear it for a month, sometimes 2, to make sure that they can tolerate it and it accommodates to their sleeping habits. And once they've been successful for wearing it for 2 months, we titrate it. So we can advance their lower jaw forward more so that they can sleep better. And then we retest them with the home sleep test again. So Candy's number from 30 went down to 3, which is within the normal limits. So under 5 is normal. And so we got her down from having severe sleep apnea to having no sleep apnea. So you can imagine, Candy all of a sudden is getting that more restful, deep sleep that is less stressful for her body, but most importantly, she feels better. She doesn't have to drink as much coffee in the morning. She doesn't have the morning headaches. We've really improved her life, and that's what I like about this treatment. It's easy to do, and it makes that change in people's lives that we've been talking about.
And it works.
It absolutely
you love this. We've had conversations on the phone because you're like the dental implant guy in San Diego. But you really like this.
I do, because it makes a change in somebody's life. And that's the same thing with dental implants, or cosmetic dentistry. We redo their smile, their personality changes. That's what's nice about the treating sleep apnea.
You call it a flip.
Yeah, their personality flips is kind of how I...
What do you mean by that? Their personality flips?
Well, you have this Candy. She's this tired individual. I've already given her the beautiful smile, but she's still tired. She doesn't really do anything before 10 a.m. in the morning. She's retired, so she doesn't have to. But that's mainly because she's tired. And, we've turned Candy into a morning person, which not many people are, maybe because of sleep apnea. The other thing that we've been able to do is, obstructive sleep apnea is highly regulated in the transportation issue. So if you're industry, so if you're a pilot flying for the FAA, they regulate and test you and screen you regularly on whether you have sleep apnea or not. Truck driver, train driver, bus driver, those sort of things. The industry is very highly regulated if you have sleep apnea because you're 6 times more likely to get in a car crash if you have sleep apnea.
All
So
right.
fall asleep at the wheel. And again, that impacts people's lives. Like this pilot that we have in my practice, he was diagnosed with sleep apnea and they took away his wings. He couldn't fly. He couldn't make a living. And you know how pilots are. You know, they love flying. It's what they do. They have this like self-identity with flying, kind of like I do with being a dentist. But this guy lost his wings, and he's like, I don't think I can wear CPAP. And he was a pilot. Can you imagine a pilot dragging around a CPAP, you know, wherever he goes? You know, we got this guy fitted in a custom oral appliance. You know, got him back in the air, back flying, back.
So you opened his airway.
Exactly.
And
very simple solution.
And it went away.
Yeah, and it fits in your pocket. So I had this patient, John. His big thing was that he was a troop leader for his son's Boy Scout troop, and of course, camping is a big part of what Boy Scouts do. And the teenagers, they sort of gave this dad a hard time because he was the snorer, and nobody likes to be in the same tent as the snorer, And he was actually already on CPAP. And he knew that he couldn't bring his CPAP. So this was affecting his social life. It has affected people's, social situations. They rearranged their life in order to avoid, sleeping in front of people or, letting them know that they're a snorer or have sleep apnea. And this guy, custom oral appliance, no more CPAP. This guy camps with his son.
He's not the snorer anymore.
Yeah, he's not the snorer in the tent
I know
anymore.
a guy like that.
Yeah, there's lots of guys like that. Lots of them.
And it's embarrassing, I'm sure, for them.
It is.
Because everybody's making wisecracks about the snoring. It's probably bothering them.
Right. And it's kind of a joke to them, but it's a serious thing to the patient because they know if they don't wear their CPAP, they're going to have these morning headaches or not sleep well or be tired in the morning and not be able to do the things they want to do. So they want to be treated. That's sort of my ideal situation is somebody who knows they have sleep apnea that's looking for a solution. And so that's perfect.
You can do this on the same day.
Yes.
Very quickly.
We have a device that's approved for 30-day use by the FDA. It's a temporary device. And if you're struggling with your CPAP, you want to know if this is a good option for you, we do. We have a temporary device that we can make for you in the office.
It's like a retainer in a way?
It is. It sits on both your upper and your lower teeth and advances your lower jaw forward and hopefully bringing the muscles out of the back of your throat that are preventing you from breathing.
It's like a tryout to see if it works.
It is, and we have to sort of titrate the position of your lower jaw to make sure we're in the optimum position. So there's a little bit of science that goes behind this. We don't just throw it in your mouth. We have sort of an initial setting that we start people at, and then we advance them forward to see if they get better and better and better. And then eventually we'll sleep test you again to make sure that we can sort of prove that your sleep apnea is gone. But you're going to feel better way before we test you.
I mean, if you sleep-deprived human beings, a lot of problems happen.
Correct. Acid reflux, diabetes. You can be at more risk for a heart attack or a stroke. It lowers your libido. It does affect your whole body. It literally affects your whole body. There's the newest research is saying that there's a direct link between sleep apnea and diabetes, type 2 diabetes. And it's sort of an amazing revolution that a field of medicine that's been ignored for so long can have such a profound effect on one's whole body.
Well, we have medical doctors on this show. Some of the biggest names in integrative and functional medicine. And their big thing is you've got to get patients sleeping. And when you get people back to sleep, and this is a very interesting crowd because they think they're sleeping,
right? And
you say they're not really sleeping because you've tested them and they're waking up 30 times in 1 hour. But is that unusual, 30 times in an hour? Or is that like the normal CPAP patient?
That's a normal CPAP patient. That's not normal in the fact that you should not be waking up 30 times per hour at night. So if you are, that's a problem. If you're not getting into that deep sleep, that deep REM sleep, your body is not able to repair or rejuvenate itself like what sleep is designed for. So yes, it's not normal, but it is common.
So when they get back to sleep, obviously if you have more energy, you have more ambition, you have more of that, get up and go to do things. Have you experienced that when you give them this appliance therapy, opening up their airway? Do they say they feel better?
Yes, this patient I had just last week, he said, when I wear the device, I don't have morning headaches. I mean, his big deficiency, or the thing that really bothered him, was his morning headaches. And he's like, it's like flipping a light switch. When I wear it, I don't have morning headaches. If I don't wear it, I have morning headaches. It's as easy as that. And it's very profound to listen to this guy talk, because it was he'd previously been diagnosed with sleep apnea, hated his CPAP, and he responded to me being on the radio and said, I know there's something better. And another funny thing was, I was in the operating room last night treating a dental emergency patient at Scripps, and I was working with the anesthesiologist who put the patient to sleep, and I was doing the work. And he's like, yeah, if they could come up with a solution for not having to wear a CPAP. Because we said that this patient definitely has sleep apnea. We all in the room could tell that. And even though she hadn't been formally diagnosed, we knew she had.
So you're there with a bunch of medical doctors.
Yeah. And he's like, yeah, if they could invent something to where people didn't have to wear CPAP. I'm like, this is a medical doctor.
Did they know who was in the room when they said that?
No, they didn't. And I said, there is a solution. It's an oral appliance. It advances your mandible forward, and you don't have to wear CPAP. And again, I felt like I was, this is a person that should know the treatment options for sleep apnea, an anesthesiologist.
And it's covered by medical insurance.
It is, absolutely. And it's covered by Medicaid as well. So these aren't typically out-of-pocket expenses like your CPAP. The medical insurance will, pay for you to be on CPAP. They'll pay for you to have an oral appliance because they want you to be healthier. They don't want you to have a heart attack. They don't want you to have a stroke. They don't want you to have diabetes. All these things that they want to prevent. Believe it or not, insurance companies are in the same business, that I am in prevention. They're just in it for a different reason.
Logically, it does make sense. I mean, if you put something in the mouth, opening up the airway, right? It should work.
It's a no-brainer, yeah. And if you, like I said earlier, if you're a severe sleep apneic, you should try and see if you can tolerate CPAP, because it works 100% of the time if you wear it. If you aren't able to wear it or get comfortable at night to wear the CPAP, it's not going to work for you. So let's try an oral appliance. If you're stopping breathing 30 times per night and we reduce that to 8, that's going to add years to your life. My dental hygienist, she's severe sleep apneic, and we got her down to 3, which is normal. So below,
what does that mean?
Below 5 is normal. If you're stopping breathing 30 times per hour.
So waking up
30 times per hour, you're in the category of a severe sleep apnea. If you're under 5, that's considered normal. So, and we got her down to 3, and she was severe. So it works in even severe sleep apneics. And I would argue that it's more comfortable. It fits into your lifestyle probably a little bit better than wearing a CPAP.
We are out of time. But before we started, you said there's 4 things I want to get across here. No more CPAP. Same day delivery. That means you can go in, get molds same day. It's FDA approved as a medical device.
Correct.
Medical insurance covers this if you have PPO or Medicare, right? And you have home sleep testing. They don't have to go to a sleep lab.
Right.
So it's all right there. Have you ever had, so you've had success? Like every week you have people that this is working on?
Yes, every day. This is a daily.
Every day?
This is a daily part of my practice now. Either we're treating somebody, we're following up
and
with
it's
somebody,
working?
And it's working,
every day. Now, why did you wait till the end of my show to tell me that part? That's because that's the good news. So every single day, and what do people say? So when it's all done, they go, I should have done this years ago, or?
Yeah, the best analogy I've heard from a patient is that they're like, Doc, I felt like my head has popped out of this fog that I've been in for years. And I didn't even really know that I was in a fog. But I see things more clearly now. I'm more alert. I know I'm better at work. I'm just functioning at a higher level. I have more energy. I can exercise more. I thought that analogy was great. It's like my head has poked out of the fog. I just have this clarity that I didn't have before. And I thought that was a very profound thing that the patient had said to me. So that's what I strive for in all of my patients. Number 1, if they don't need to be on a CPAP, they don't have to be. And then if you don't know whether you have sleep apnea or not, we can help you figure that out.
But if you've been told you snore really loud, you're headed for that.
Right.
Is that right?
We talked about the number 1 sign of you having sleep apnea would be that somebody witnesses you stopping breathing while you're sleeping.
Right.
The second most common way to diagnose sleep apnea is loud snoring.
And this can stop that.
Yes, absolutely.
So it's just like a retainer, but it happens to be a little bit bigger.
Yes.
Opens up your airway and you go to sleep.
It's not even
That's
really
it?
that much bigger.
Wow, and you can carry it in your pocket.
It's a retainer on top, a retainer on
So if you're going
bottom.
camping, you can just carry it, whatever. Is that what Dr. Henninger, he carries his in his pocket?
Yes, sir.
Or his fanny pack?
It's fanny pack, yes.
His fanny pack. Look, I want to thank you for coming on the show. Always a pleasure. And by the way, one last thing, because I don't even know that people are wearing CPAP. Is it really something that people are doing?
Yes.
Here in San Diego, there's a lot of people?
We get a lot of phone calls from our radio show for people saying, I wear a CPAP and I do it because I know it's the right thing to do, but I hate it. And so these people are actually
So there's like thousands of people wearing CPAPs?
Absolutely.
And so you can wipe them out. I mean, you're trying to like say, hey, no more CPAP.
I'm saying, hey, no more sleep apnea. And also we can help you if you want to get off your CPAP.
And you have a tryout period.
Yes.
I mean, for a little bit of money.
Yes.
They could try it out for a month.
Absolutely.
See if it works.
Yes, you can wear our FDA-approved temporary sleep apnea device for 30 days. It's FDA approved. And then we can get you into a permanent device if you want to, and your medical insurance will cover that.
The PPO or
Medicare.
Okay, good.
Most major medical insurance will cover this device.
Always a pleasure to have you on the show. Thanks so much. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.